Hello everyone, I welcome you back to the channel. Today we have with us Dr. Sameera Davalbhakta. And in the previous video, we saw that how one should prepare for Usmle, a very important exam again for UK, practicing in UK is PLAB. So today we have with us Dr. Sameera, who will be giving her insights on how you should proceed in preparing for PLAB. What are the differences in PLAB versus UMLE, why she chose PLAB, and also how you can plan your entire journey in such a manner so that you could succeed in this particular exam. A little about her, that she is from MBBS 2016 batch at BJMC Pune. She has given her PLAB 1 exam recently and we are hoping for awesome results for the same. She is available on her Instagram handle at Mad with the Sam, and on the blog is the similar name, Mad with Sam. I'll mention her handles. You can subscribe to her newsletter as well. So I welcome you, Dr. Sameera, on this platform, and thank you so much for your time to guide our juniors.
Hi, thanks. It's good to be here.
So like right now, I say that you are now guiding the juniors. How does it feel, to guide the juniors in the journey, which once you have started, maybe you did not knew about it, then you got someone as your mentor. And right now you are in that state that students can look up to you to, guide in their journey as well.
I mean, I'm still sort of digesting the fact that I finally started the journey that I've been meaning to start for so many years. But yeah, it feels nice. I mean, it feels good to have people ask me questions because I feel like I'm giving back. When I also ask so many people and I really bug them for answers. So I still have a lot of people who have asked me a lot of questions and I haven't answered them yet. So yeah, but I've only just started on my journey, to be honest. This is like step 1 and I still have a huge way to go. So We'll see. Yeah.
Definitely. So our intent here would be the same, that all the juniors watching it, unhe ek hi jagah pe everything what is required mil jaye, so that they can start preparing for their journey. So let's start with the questions that I and the students have. So for the beginners, could you please tell what exactly is PLAB for practicing in UK?
Okay, so it stands for the Professional and Linguistics Assessment Board, but this exam is divided into 2 parts, PLAB Part 1 and Part 2. The purpose of the exam is to check whether international medical graduates are at par with their medical graduates, specifically at their foundation year 2. So, in India, we have 1 year of internship. It's kind of like they have 2 years where they finish their final year of medicine and they do foundation year 1 and they do foundation year 2. So then the PLAB sort of tests the foundation year 2 level, but it doesn't mean that only those students are allowed to give it. Literally anyone can give it, because what you get from passing PLAB 1 and PLAB 2 is a registration called the GMC registration. That's it. Sort of, you can compare it to the registration we get in India.
Okay.
Once we pass our exams. So that just gives you a license to practice. And after that, you have to apply for a job and this and that. And then the whole procedure starts from then on. But yeah, that's the purpose of PLAB.
Okay, sure. So like, who all are eligible to appear in the exam and what should be the ideal timeline to appear in the particular exam?
Right. So I'll answer your first question, eligibility. You basically need 3 things. You need to have this GMC online account, which you can make. You just go to the GMC website. That's GMC, that's General Medical Council website. You need to have an English language proficiency test. So that could be your IELTS, or there are different tests that you can give to prove that you have a good level of English. And then finally, you need an acceptable overseas medical qualification. So what that means is they have a list on that GMC website. They have a list of universities from which they accept the medical qualification. So I'm from BJMC. So my college name is on the list. So you need to make sure that your college name is, and if not, you need to contact them and ask them what to do now. Because if it's not, then most likely you cannot apply for a license. So that's one of the first things you need to check. So it's as simple as that for your eligibility criteria. Okay. And then when it comes to what is the right time to give it, you cannot give the exam unless you have passed your final year. You cannot take PLAB 1. So I think in USMLE you have 3 steps, I think now, or 4 steps. And step 1, you can give in your 3rd year, but so that's before you pass. But it's not like that for the PLAB. You're not allowed to open a GMC online account unless you have passed your final year and you have your, I have passed my final year medical exam certificate. So yeah, the appropriate time would be anytime after that. Okay, I mean, when I went for the exam, there were people of all ages from my age to older individuals who might be post PG who want to go to the UK. So it really is any time.
Okay, fine. Right. Okay, so a bit, a simple procedure as compared to USMLE, that you need not to worry. Maybe in your initial years of MBBS, you need to focus on maybe finishing your final years first, and then you can, yes, absolutely, you can give that whenever you feel you are comfortable with. So regarding this, do you need some special, textbooks, coachings, any difficult, different approach from what usually students study, maybe in their MBBS, or for NEET PG, maybe next, which is going more bit of a clinical? So what are, some special approaches that one need to follow right from maybe first, second year, whenever?
So next, I don't know about. I mean, I don't know enough to speak about it right now, so I won't mention that. But
nobody know about it.
Yeah, I mean, when I heard about it coming, I got really scared and I said, oh, my junior's not made. So I'll focus on other things. But when it comes to what is the right material that you need for the PLAB, like you said right now, it's important to focus on your MBBS and your curriculum for your MBBS when you're studying. Because when I was studying for my PLAB, I realized that helped me a lot because I paid attention to my years and I knew stuff. So while studying, it was relatively easier. Second, there are no specific textbooks. I mean, you don't have like textbooks that we might have for the NEET, or you have like Marrow books or whatever. You don't have that. You don't have that here. But what you do have is different companies that are based out of some in the UK, some in the US, where they have their institutes that they have, that private ones, not validated by the GMC at all, where they give you study material, practice tests, MCQs, and there are lots of those out there.
Okay.
You have Plabable, or you have Med Revisions, or you have Past Medicine, Samson's Notes, and then there's a lot. And I think my first advice to anyone who's watching us and wondering, okay, what do I need to study, is number 1, join a Facebook group. There are these Facebook groups that are made for PLAB 1. And then I think there are Telegram groups now. And you will get a lot of posts written by people who have passed the PLAB 1, and they've given their opinion or their experience of all of these things. So that helped me make my decision on which one to take, because it gets very confusing. What do I study from? So that's step 1. Go on those groups, read up, spend a couple of hours and find out from that. What I used was just 2 things, 3 things. I used Plabable, the MCQs from Plabable. I used Med Revision, and then I used a notes called Plab Key. So it's kind of like, you know how we have notes that we study for the NEET? These is just fact after fact, fact. It's like that. It's a bit like that. And those notes with my Plabable, I combined the 2. So I would study the notes and then I would solve the MCQs from Plabable. And that helped me, solidify my concepts. And then I used the mock tests in Med Revisions to strengthen my concepts. So that's what I used, but some people have used other things and they have passed as well. So yeah.
Okay, fine. So now many students, they want an exact timeline कि आपने कैसे किया बस वो बता दो. So हम उसी चीज को follow up कर लें. So right, on the same note, if I ask that, okay, you have to give it after final year, but when do you actually started being serious for PLAB 1? Like maybe in first year, second year, you started devoting some of your time to read those materials, to solve those MCQs. So when should one start preparing for PLAB 1, keeping in mind he or she have to give it after his final here as well? Yeah, okay. So I'll answer this question in like 3 points. First of all, when I started researching about the PLAB, just like you said in your question, I had like this
plan where exact ideal, I followed somebody else who would follow that plan, give it here. And then COVID ruined it all. So I've had to sort of play by whatever was getting thrown at me. So I can tell you how I gave the exam, but then it might not be an ideal situation. Second thing is, when do you start studying for it? So my second point here would be there are sort of two ways to any exam, really. The first is knowledge-based studying. The second is studying for the exam. I don't know whether it's our education system or what, but the two are very different.
Right.
So when we study for knowledge, you can start whenever. I sort of did kind of start in my final year when I was studying, let's say, medicine. I was solving MCQs based on that topic, which I think I had accessed from med revisions. And then when I was doing surgery, then I'd solve MCQs. And that helped me get into the habit of MCQ solving and remembering some of the key points that I needed to. But when I started studying for the exam, which means timing yourself, developing the ability to solve the question in under 40 seconds and moving ahead, those kind of things, that really starts 2 to 3 months before the exam and not before that. So you can easily, if you have an exam in like January, you can, in Feb, you can start in November and you'll be fine. Of course, that depends on what stage of your education you are at. If you have just passed your MBBS, it's going to be easier because you remember. But if you are far ahead, maybe you've super specialized in something on the surgical side and you've left medicine far behind, you might not remember too many things. But I mean, it could be subjective basically,
Right.
but 2 to 3 months is enough. So yeah.
Okay, fine. So one should always keep in mind, the timeline, as well as one should understand that focusing on your MBBS is very important. And maybe for, just practicing MCQ side by side and focusing more towards the exam pattern in the later months could also do very well for you. So now on the similar note, how many attempts can one person give? Maybe if he start giving after his final year. So what are the, limits on the attempts?
So all these rules are given on the GMC website. So it says that you can give the exam only 4 times. You can't give it more than that. And additionally, I'd like to add that from my experience, and a lot of people around me have experienced that booking the exam is very difficult because there are limited seats and they go very quickly. So let's say, so for example, we're in year 2022. In a couple of weeks, I think, or they've already released it, I'm not sure, but they have released the dates for 2023, which means they release the dates so far in advance and they almost all get booked, or you get a date quite far into the year. So it's not as easy as, okay, you give the exam in Feb and you realize you have failed and then you easily book another test soon. It's not as easy as that. So there are 4 attempts, and I think that you have to apply to the GMC and give a valid reason why you would need another attempt. But yeah, that's 4 attempts.
Right. Okay, so like as we came to know that there are 4 attempts, so what is the basic timeline difference in USMLE versus PLAB? As all must now know that USMLE is a bit complex with so many steps involved. PLAB, on the other hand, seems a bit more, straightforward once you start getting into the process. So what are the points of difference? Students would like to know that if you are right now, if you are in first year, how you decided, nahi, mujhe USMLE nahi, mujhe PLAB karna hai. So that points which, everyone would want to know.
Okay. So how I decided the difference between the two was, I think perhaps you could either focus on the country, do you want to live there or not? You could focus on the field that you have chosen. Do you have an interest in medicine? Do you have an interest in surgery? Base your decision on that. Or then you could base your decision on the ease. If your aim is to go outside the country, but you don't mind either, so you think UK is easier, so I'll go to the UK, fair enough, that's your choice. So for me, I have experience of living in the UK, and I have family there, so that sort of made me want to choose the UK over the US. Secondly, I feel as though the US, the steps were far too complicated, and I felt I would get equal opportunities in both countries, so I chose the UK over the US. But some people tend to choose the US more, maybe because it has more, I don't know, technology innovation, or maybe because well, I mean, it's a factor that's quite important, but the US pays far more than the UK. I think about 3 times more or something like that. I don't know, I could be wrong, but it definitely does pay more than the UK. So that's something that people consider as important as well. So yeah.
Okay.
But as when it comes to the pathways, like you mentioned, a difference in the pathways of PLAB and the USMLE, both are the UK definitely is a bit easier than the US, so that could be another reason why people would choose it.
Right. So on the same note, like you said, that you have to give, first of all, you need to focus on PLAB 1. Now, once a person maybe gives PLAB 1, gets selected, what is the pathway after PLAB 1? How will, one match into residency, when he or she will start, and then what is the usual course?
So it depends on what purpose you're giving the PLAB for. If you have finished your final year and you want to start your PG in the UK, then you give PLAB 1, you get your results, you book PLAB 2, you give PLAB 2, you pass both, you get a GMC registration, and then you apply. Now you apply where? Most international or international medical graduates apply for a standalone FY2 program if they finished 1 year of internship in India or anywhere. They complete that second year of internship by doing something called a standalone FY2 program, which is specifically for international medical graduates in the UK. So you apply for that. So then there's an interview process, an application process for that. If you don't want to do that and you want to get into specialization directly, then you apply to each individual specialization. So yeah, it depends there. And if your listeners or your viewers want more information on that, it's all available on the GMC website. So they can just look it up, because there are different pathways and it gets a bit complicated.
Right, definitely. So obviously, no path is, easy, but you need to once of all focus that what is the ultimate product that you want. And like Dr. Sameera said, that it's all up to you, that whatever you decide, like your family part, your future part, and all that things, that whatever suits you better. So now on this thing, I received a lots of comments and DMs in the previous video that many students think कि यार अपन नीट पीजी की भी तैयारी करते चलते हैं, यूएसएमली भी दे देते हैं, अगर हुआ तो वेल एंड फाइन, प्लैब का भी धीरे धीरे, जैसे टाइमलाइन में तो फाइनल ईयर के आसपास ही है. सो वन माइट थिंक कि एटलीस्ट 2 एग्जाम्स को टारगेट करे, और अगर नहीं भी हो पाया तो इंडिया में नीट पीजी का तो सिनेरियो इज ऑलवेज ओपन फॉर एवरीवन, राइट? सो नाउ व्हाट वुड यू एडवाइस to a student, like for your example only, are you also side by side giving the NEET PG, which would be in May, or you would advise that no, one should focus clearly on one exam, because सबका प्रोसेस काफी डिफरेंट है, काफी सबका एक टाइमलाइन है. सो व्हाट वुड बी योर से ऑन दैट?
I would say that if you are willing to make sure the exams are not placed around the same time, for example, like this year's NEET is in May, and if you have booked your PLAB for after far after or far before May, then sure, go ahead, you can prepare for both, because like PLAB needs only 3 months. So if the rest of the time you prepare for NEET to 3 months of PLAB, then you'll be fine and you can keep your options open like that. But if they're both going to arrive at similar dates, then at least make it a point to prioritize. My focus is NEET. So you don't prepare for PLAB, just sit the test, but you give NEET. But the test costs £240. Okay. You have to pay £240 to take the PLAB 1. So that may be something that you'd want to take into consideration. I'm giving £240, so I would want to focus on that also, not SE give it.
Right.
But yeah, basically make sure they're not happening at the same time, and then you'll be fine.
Okay, fine. So like you said, the cost for PLAB 1 like £240. In the previous video, we discussed that around the cost of USMLE in the entire journey costs around 20 to 25 lakhs for a student. So they must have that kind of reserve as well, so that they do not get themselves drained financially. On the similar note, would you like to advise any financial capacity one should have while preparing for PLAB, and how much?
Right. So I have just begun my journey. I have not completed it. So I can only tell you what I've read on different blog sites. And they've all given me an estimate between 6 to 10 lakhs for the entire journey of putting yourself in the UK. Then after that, the living costs over there, provided you get a job as soon as you get into the UK, all those things I think will make a difference. But 10 lakhs could be an estimate that you could take at this point. But yeah, I can only tell you for sure once I finished it. I can be like, hey, yeah, I was wrong or I was right. So yeah.
Sure, definitely. So at this point of time, what we can, grasp from the session is that, many students might think that, okay, PLAB is say a less discovered route, maybe less competitive, but at the end, you need to understand what is your inner calling. You can't just rush behind US or UK or any platform. You need to, first of all, get your head clear that what are your resources and how you should plan it. So now some, final tips, like, first of all, I would like to have sort of a rapid fire, that since you are active on a lot of platforms, like your Instagram handle is very informative, you keep making awareness posts for general population, as well as your reels are somewhat viral also. So now what would you advise, our juniors, so that this will help in their CV building as well, right? So what would you advise for anyone to, do some extra curriculars for their CV building, and is it really necessary as well?
Okay. Is it necessary? Absolutely. Perhaps we're not used to it in India, where we don't realize that building a CV in UG is not that important because PG to marks pe milta hai. But in the UK, for example, they will look at your CV, they'll look at the research you've done. But it's not just, ठीक है, चलो एक professor के साथ जाते हैं और एक कुछ तो study करते हैं. It's not even like that anymore. If you say that I want to do medicine, what the person assessing you will look for is, have you demonstrated an interest in that field? So have you done medicine related research? Have you given medicine related case presentations, things like that? So I think something that I'd like to add is that people need to, if you're going to the UK or the US for a better quality of life, that's fine and that's perfectly, good for you. But you need to focus on thinking about what field you want to take, what interests you. That would be my biggest advice to you, because grass is always greener on the other side. So it'll always look like UK US itna acha hai, idhar ke problems nahi hai. But if you don't know what interests you, then you're not going to be able to build your CV, or you're not going to be able to work towards a goal. So for example, let's say I'm interested in general surgery. Then I would, through my years in MBBS, or even after, do research related to that, do case presentations, start a general surgery sort of a group, like a college, a discussion group, or I would give talks, things like that. So CV is very important, and a focused CV is important, not just ye kiya wo kiya or add kiya, just dikhne ko. It's not like that. Yeah.
Right. Definitely. And also our juniors, I guess, would now, also want a part 2 from you, in which you can maybe tell about the research opportunities, from where to begin, various, resources. Also, I guess you have made some of the content on your blog as well regarding this. So one can always check that as well, right?
Yes, thank
Okay.
you. Yes.
So now continuing about that rapid fire, the language jo exam hai, like you said. So how, students should approach it, and what preparation is really required in that? Any special preparation?
So I gave the IELTS test. I think there is an OET test that you can give as well, that they consider, but I don't know anything about it, frankly, because I was confident with the IELTS. I would say that you need to assess how strong you are with the English language, and just being able to speak English is not enough. If you have a habit of reading, if you have a habit of writing, then you're going to be better off than some who speak easily when they're given, for example, school mein kaise hame podium pe jaake bolne ko ek speech dete the assembly mein, or agar watch, so that doesn't mean that we have a hold on the language. So you need to assess that first. not because you want to make yourself feel like you don't know the language, no, because you need to decide the preparation time. And that's important because when it comes to IELTS, there will be some people who will tell you, kya padhai kar raha hai iske liye? Kuch nahi lagta, 2 hafte lagte, isse zyada nahi. But then there'll be some people who fail the test as well. And it's not because they're not good, it's because they just needed a different preparation level. So assess yours first, and you can do that. So I think the British Council Library has an app. The app has practice tests that gives you a score. Use that to assess what your preparation level is, and then book the test. Don't book the test before that because it costs something between 10 to 14,000 rupees. So check it first, then book the test, and then take it from there.
Okay, fine. So I guess हमने काफी detail में समझा entire pathway to the UK, how you should approach it, and what are the mistakes or what are the learnings from it that you could advise. So now one final question. Right now, Dr. Sameera is not Dr. Sameera. She is an MBBS first year student who have just started her MBBS journey. So now. What would you advise her ki final some mistake या whatever जल्दी शुरू करना चाहिए या थोड़ा सा stable हो जाओ पहले MBBS में, so some golden keywords जो student हमेशा ध्यान रखे इस conversation से.
So I will give you an answer, but you're not going to expect it. I would say to my first year self that please relax, things work out in the end. I spent a lot of my MBBS thinking about, मुझे क्या करना है, आगे क्या करना है. I need to do something now, I need to have this research going on, I need to have that going on. I hold all this stress, and I think it's important to realize that अगर होना है life में तो वो हो जाएगा. Of course, you have to work towards it, but don't stress out. Things will happen in its own time. So I would tell myself to chill. Yeah.
Definitely. So thank you so much for your advice, Dr. Sameera. So ultimate जो learning वो यही है कि serious होना future के बारे में एक दूसरी चीज होती है और constantly stress करना एक दूसरी चीज होती है. You need to be self-aware. You need to know what in which field you belong, but you need to also enjoy the zone in which you are currently present. So now advice for the juniors would be to just enjoy your MBBS journey, prepare well for whatever exam you are planning to, and if you face any difficulty, you always have mentors like her available for you. So you can surely follow her on Instagram and DM her with all the queries that you might have. So thank you so much, Dr. Sameera, again for your time, and I would expect more upcoming guidance session for our juniors in your entire journey.
Yeah, sure, definitely. Thank you for having me, Akshat. It was a pleasure. Thank you.
Thank you so much. Thank you guys. Stay safe, stay healthy, and keep learning.